Peter Aldous.
Thank you very much, Mr. String. It's a pleasure to serve with you in the chair, and I congratulate the Honourable Member for Bath for securing this debate. I shall focus my comments on the work of the East of England Ambulance Service and the James Paget University Hospital, who together serve North Suffolk and East Norfolk, including the Waveney constituency. The staff and management of both these NHS trusts are under enormous pressure at the current time and are working incredibly hard to meet a challenge which is largely not of their own making. The East of England Ambulance Service have faced a number of institutional and cultural challenges over the past decade, which the current management are addressing. During that time, for the most part, they have provided the local community with a good service, though there have been 3 occasions when they have not done so. In 2012, when the system broke down very badly, at around Christmas time in 2017-2018, when the management at that time failed to properly plan for seasonal pressures, and today, as they work against a very, very difficult backdrop. For the week ending the 26th of June, the average arrival to handover delay at the James Paget was 1 hour 30 minutes. For the previous week, it was 1 hour 4 minutes, and for a week before that, 49 minutes. The trajectory is very much upwards. The worst individual case that has been brought to my attention is 16 hours, and I'm also aware of a situation of poor triaging. Working collaboratively and in a coordinated way, the ambulance service and the James Paget are putting in place a range of measures to relieve these pressures. The hospital have expanded their emergency department, they've launched a new surgical assessment unit, and they've invested £900,000 in a new GP streaming service aimed at providing care for patients who attend A&E who need a doctor rather than hospital treatment. For their part, the ambulance service are putting more ambulances on the road, are developing co-responses with the fire services and local communities, and are staffing cohorting areas at the Paget with their own halos, that's hospital ambulance liaison officers. These various initiatives, Mr. Stringer, are welcome, and the True Trust should be commended for putting them in place. However, they are in many respects a sticking plaster, and they do not address the root cause of the current crisis. This is the logjam that has been caused by the difficulty that the James Paget and other hospitals are facing in discharging patients so as to free up beds. The Paget regularly have an average of 100 patients, that is the equivalent of 4 wards, who are ready for discharge but with nowhere to go. They've opened 22 beds at Carlton Court, a facility that they now share with the Mental Health Trust, but there is an urgent need for more beds to be made available in the community, whether at home or in care and nursing homes. The problem with care at home, Mr. Stringer, which in many respects is to be referred, is that councils such as Suffolk County Council, their social services department, are struggling to recruit carers and agencies to go into people's homes to look after them after they've left hospital. In the long term, there is a need for strategic workforce planning in both the health and the care sectors. In the short term, government need to work with councils such as Suffolk, also with the East of England Ambulance Service and with hospitals such as the James Paget Hospital, as well as with the wider care sector, to remove this blockage, which is impacting all the way along the ambulatory care pathway. I look forward, Mr. Stringer, to hearing from the Minister the government's plans for doing this. Thank you.
Morgan.